This is the Bedside Clinical Skills Faculty Orientation. I'm Alif Yusabe. I'm the content lead for this course. I want to start by declaring that I have no conflicts of interest. So many of you have been wondering, what is BCS? What will students be doing during this course? So this is the first and only opportunity that medical students will have to practice bedside clinical skills on real hospitalized patients before they enter their clerkships. During this course, they will learn the structure and organization for presenting patient information in both the written and oral format. They will practice interacting with patients in a sensitive and respectful manner, and they will gain experience with discussing actual cases and receiving faculty feedback. The course has several objectives. By the end of the year, students should be able to elicit a full history. They should be able to complete a full adult physical examination. They should be able to document a history and physical on a hospitalized patient with particular attention to the appropriate organization of information. They should be able to differentiate subjective from objective findings. They should be able to place the objective information in the history sections of the H&P, and the objective data should go into the physical exam findings. They should be able to identify and appropriately rank a patient problem list. They should be able to develop a differential diagnosis and discuss this within their assessment. They should be able to formulate an appropriate plan for their level of learning. And lastly, they will be able to deliver a concise and well-organized 5-minute oral presentation. This course is designed in a small group format. This allows for group discussion, peer feedback, and hopefully bedside teaching rounds where you'll be able to show students interesting and abnormal physical exam findings. Each student is required to attend 4 sessions. There is 2 in the fall and 2 in the spring. Each session is about 3 to 3.5 hours long. If a student does not show up for their session or sends you correspondence regarding an upcoming missed session, please inform me. Ideally, each group will have the same facilitator throughout the year. This will allow for consistency in their feedback. Before the first BCS session, you should check the clinician educator schedule to see when you are scheduled for BCS. Once you determine that you are scheduled for BCS, look on Entrada to see where you are scheduled. For faculty scheduled on GMF, you will need to book a conference room for the small group discussion with Denise. Please do this as soon as possible. You can book in advance for the entire year. On the day of your session, if you're scheduled to be on GMF, you will receive an email from one of the BCS coordinators with a list of patients who are willing to participate. About 20 to 30 minutes prior to the BCS session starting, you should confirm with these patients that they are still willing to participate. If you are assigned to the ED, you will find your conference rooms on Entrada. On the day of your session, you will go to the ED to find your own patients. A good way to do this is to ask the ER attendings for ideal BCS patients. Then you will go and ask the patients for their willingness to participate. An example of how I approach a patient would be as following. Hi, Mr. T. I'm Dr. Yusabe. I'm one of the ER doctors. Have you been to Rush before? Are you aware that we are a teaching facility? We have a medical school and lots of residency programs. Today I'm looking for nice patients to help my second-year medical students learn how to take a history and physical exam. They will be asking you why you're here today, your past history, and they will examine you. They will not be doing anything invasive. Would you be willing to help? I find that many times when I ask in this way, most patients are willing to participate. It's important to get 1 or 2 extra backup patients just in case one of the patients is away at a procedure or drops out. So what happens during each BCS session? Each session will start with you meeting your students. If you're assigned to GMF, please meet your students at ABP. If you're assigned to the ED, you will meet your students in the assigned conference room. If this is your first time teaching this particular group of students, introduce yourself and tell them a little bit about your background. You will also need to give them your phone number for emergencies. You can choose to give them your cell phone number, a portable phone that you carry when you work clinically, or even your pager number. If you give them your pager number, you will also have to teach them how to use the paging system. If this is the first BCS session for this group, please recap how each session will run. Next, you will assign students patients. Students will then have 5 to 10 minutes to review the patient's history and medications in Epic. They should only be using Epic to look up past medical history, surgical history, and medications. They should not look up any other notes in the record, family history, social history, or allergies. You will then introduce the student to the patient. Once inside the room, please familiarize the student with the room. This would include how to mute the TV, how to operate the patient's bed, if the patient is on the monitor, what each of the numbers mean, how to use the call light, and if you're in the ED, how to get supplies. Please watch this video for an example. All right, Derek, let's meet your patient.
Okay.
Hello? Mr. Tran, can we come in? Hi, sir. I'm just going to turn down the TV real quick, okay? Mr. Tran, this is Derek. He's our second year medical, so he's me talking to you today. I'm just going to show him around the room really quickly.
Okay.
So I pushed mute on this TV. It's also the patient's call light. If the patient or you needs anything, you're able to push this big red button to call a nurse.
Okay.
Okay, so you can see right now he's on the monitor. This blue wave is the patient's pulse ox. This blue number underneath is his pulse, his heart rate. He's not on the monitor right now. It's picking up the pulse oximeter heart rate. And then this number in purple is his blood pressure. To operate the electronic blood pressure cuff, you'll see a start button. All you need to do is hit that button start, and it'll start taking his blood pressure. Okay? And then back here you have the machine to take his temperature. The probe comes out. There's covers here right behind it. You're going to slip a cover on. It's going to go underneath his tongue, and then you'll see the machine. It'll start kind of spinning to give you a number. It'll beep. That's the temperature, and then you just push this button to discard the top. If you need a otoscope, we have that, ophthalmoscope, and then let me show you where the covers are. 2, 2, 4, 4. You're gonna hear a little click. You're gonna unclick the button here. Squeeze these two together to open the door, and then you're gonna pull this top open. In the top, you'll find otoscope covers. If you need tongue depressor, will be in here too. Okay. So to bring the patient's rails down, you're going to click this yellow lever up, then the rail goes down. To bring it back up, all you need to do is push it up.
Okay.
So down, and then if you want to lay the patient down, yellow lever up, and then it's going to release the top of the bed and you can lay the patient down. Same with if you want to bring him back up, pull it up again, bring him back up. Okay? Students will then have 60 minutes to perform an H&P. Once this is completed, they should meet in the assigned conference room. Students will then have 15 minutes to devise their 5-minute presentation. Once all the students are ready, each student will give their 5-minute presentation to the group and receive attending feedback. At the end of the session, if time allows, please take the students to a patient's bedside and show them an interesting or abnormal physical exam finding. Remember that each session can run 3.5 hours long. After each BCS session, students will submit their written H&Ps onto Blackboard within 3 days. You will then edit and comment on their written H&Ps. You will grade their performance using the grading rubric. Please submit these grades within 1 week of the student's submitted H&P. This is 10 days after the BCS session. Now let's run through how to use Blackboard. Once you go to the site, you'll enter your username and password and log in. Once in Blackboard, you will see your name at the top right-hand corner. If you click on the drop-down arrow, you will see recently visited courses as well as all your other courses. Within this drop-down box, you should see a course called M2 Longitudinal. It's not currently available, but should be by the time you guys submit your grades. So let's just say that this says M2 Longitudinal. I would click on it. It will open up the course. On the far left-hand side, you're going to scroll down till you see Grade Center.
Click on Grade Center and it will open up all of the groups. Please look for your name. Down here I see my name with 4 groups. I want to open the group whose H&Ps I want to grade. This will pull up the students' names and the H&Ps that need to be graded. On the top, you will see the student's name, H&P. Scroll down to see the students whose H&P you would like to grade. Once I find that student's name, I'm going to click on the arrow to grade the H&P. This arrow will bring down a drop box. Please click on Attempt. This will open up the student's H&P. These 2 buttons here will allow you to edit and annotate the student's H&P. The pencil-looking object will allow you to make drawings. I usually don't use this one because I don't find it helpful. I normally use this comment text box. To use it, you simply click on it, find an area where you wish to make a comment, click, and write your comment here. Once your comment is written, please hit Post. You will then go through the entire H&P in this way, making comments and edits as you see fit. Once this portion is complete, the next thing you want to do is fill out the grading rubric. To get to the grading rubric, please pull down this arrow. Once you click on it, it will open up the Student Performance Evaluation. Click on this. This opens up the grading rubric. This is the 34 items on which you need to grade the student for this particular BCS session. Scroll through and you will go through each of the 34 items, grading it with either a 1 or a 0. Once you've clicked through all 34 items, at the bottom it will give you a total. Please make sure that your total is out of 34 so that you've graded each of the 34 items. Once completed, hit Save. Scroll back up and you will see that there is now a comment box that it's open. Please write any comments in here that you would wish the student to read. Once you see that the grade is completed in the grading rubric box and you've made all the comments that you'd like, please hit Submit. This will submit the student's grade for this BCS session.
Now I'm going to talk a little bit more about grading. A passing grade is defined as a timely completion of 2 written H&Ps with a score of at least 70% on the second H&P of each semester. As previously mentioned, students are graded using a 34-point grading rubric. Each task is graded with either a score of 0 or 1. A 0 is unsatisfactory, meaning the behavior is absent or significant improvement is needed. A 1 is satisfactory, meaning the behavior is present and demonstrated in a well-organized way, meaning little or no improvement is needed. I am now going to go through each of the 34 points. You can find more details about what's expected of the students in the Student Performance Review handout. This is available for you in Entrada. So the first thing the students are graded on is being prepared for this experience. Each student should bring with them the required equipment that's necessary. If they need to do so, they may be able to check out the following items at the General Education Resources Center in the academic building. Number 2 addresses their professional appearance and representation of their role. This would include wearing professional attire such as their white coat, no jeans, no open toe or gym shoes, and no scrubs. They should wear their ID at all times and identify themselves as a medical student. Number 3 grades their interviewing skills. The student should be listing the history from a patient and or family members using open-ended questions. They should use follow-up directed clarifying questions as needed. Number 4, the student should always be respectful. They should demonstrate respect for patients and family. They should maintain the patient's modesty and privacy, and they should also show respect to their colleagues during their small group discussions. Number 5 addresses physical exam skills. Students should be able to perform these skills that are appropriate for an M2 learner. If they need any help, they should not hesitate to ask. Remember that in BCS, no pelvic, genital, rectal, or breast exam should be performed. Items 6 through 9 grade the oral presentation. Number 6 assesses the clarity and organization of the oral presentation. Students should present in a correct and logical order. The physical exam should be described in head-to-toe order. Number 7. The oral presentation should focus on pertinent information found in the history and physical exam that pertains to the patient's current chief complaint. Number 8. The student should include an assessment of the patient's chief complaint. They should propose a differential diagnosis and be able to explain why they think various differentials are more and less likely. Lastly, they should develop a plan with recommendations. The students should not just report the plan from the patient or other doctors involved in the patient's care. They should be able to offer their own reasoning to support recommending various diagnostic, therapeutic, and patient education plans. Items 10 through 34 grade the written H&P. Number 10, the chief complaint is clearly stated. The chief complaint should be stated in a concise phrase that explains why the patient sought medical attention. Number 11, the student should also have a statement of the source of the history as well as the reliability. They should include any factors that may confound the reliability of the historian. 12 addresses whether the HPI is logically organized in a narrative form. It should begin with an introductory sentence that includes the patient's age, gender, pertinent past medical history, and their chief complaint, specifying for how long they've had this problem or when the problem started. The reader should be able to understand the chronology of the patient's presentation. The student should include the presence and absence of symptoms to support or refute later differentials that they will propose. The HPI should use subjective descriptions as well as correct medical terminology. No objective data should be listed here. The HPI should also thoroughly characterize the patient's symptoms using the OPPQRSTU acronym. The HPI should include pertinent positives and negatives gathered in the patient's past medical history, past surgical history, family history, social history, and review of systems. Lastly, the HPI should include a statement informing the reader of the patient's understanding of their illness. This will help the patient's care team to develop an appropriate patient education plan. The past medical and past surgical history should be in list format. They should be organized by level of severity or chronologically. Family history should include all first-degree relatives. The student should include whether or not the relative is healthy or has any medical history. Other relatives should be included if they have history that's pertinent to the chief complaint. For the social history, they must include alcohol, tobacco, and drug use. Sexual history does not need to be included if it's not pertinent to the HPI. 20 assesses the patient's medication list. This should be in a list format with the name of the medication, the dose, the route, and the regimen. 21 identifies the patient's allergies and prior adverse reactions. This should also be in a list format and address the type of reaction the patient's had. 22 grades the review of systems. This should be complete in a list format organized from head to toe by organ system. The positives should be listed before the negatives in each organ system. The next 3 items refer to the physical exam. The physical exam should be complete. The students should note any reasons for deferring portions of the exam. The physical exam should also use appropriate objective descriptions. They should avoid using the word normal. The physical exam should also be organized by organ system in list format, starting with vital signs, general appearance, and then organ systems listed in the head-to-toe order. Number 26. The problem list should be organized from highest to lowest priority. The chief complaint for this encounter should be listed as number 1. The problem list should also include all other problems identified in their review of systems, physical exam, and all health maintenance issues, which include active problems from the past medical history, past surgical history, social history, and preventative medicine. Items 27 through 31 grade the assessment section of the H&P. It's important to note that students may not have covered the organ system related to the patient's chief complaint. Students should not be penalized if their explanations are incorrect. They should receive satisfactory scores that include all the required components on the grading rubric. Students should be using the IDEA method to develop their assessment. The I in IDEA refers to interpretive summary. The students should give an interpretive summary which references history and physical exam data presented in earlier sections that the student believes are pertinent to the differential diagnoses being considered. The D in IDEA refers to differential diagnoses. Students should propose and define differential diagnoses and link them to information presented in the history and physical. The E stands for explaining which differential is most likely. They should rank the proposed differentials and offer explanations for choosing their most likely diagnosis. The A is for alternative diagnoses. Students should propose and define alternative differentials and explain the reasons for prioritization from most to least likely. Lastly, the assessment should include all active problems within the patient's problem list. Only the chief complaint needs to have the full assessment using the IDEA method. All other active problems can have a brief assessment. The last 3 items of the grading rubric refer to the plan section of the H&P. Remember, the students will not be penalized for incorrect plans. However, they must be able to offer explanations for recommending each of these diagnostic tests or therapies. 32. Students should include a diagnostic plan that would further clarify their diagnoses. They should offer reasons why each proposed test will help confirm or exclude the considered differential diagnoses. 33. They should also include a therapeutic plan, and they should give explanations for why they're recommending each of the treatment options. Lastly, there should be a patient education plan. The students need to identify appropriate patient education needs and how to address these. I would now like to address some issues that may occur during your BCS sessions and how to troubleshoot these. What happens if there are not enough patients? If you're assigned to GMF and you've exhausted the list that was provided to you by the BCS coordinator, your next step would be to try to identify a hospitalist. In Entrada, you can see a list of the hospitalists along with their pictures. Please try to locate one of these hospitalists and ask them for help. They are a great resource in identifying patients that are appropriate for BCS. If you still cannot find enough patients, your students are able to partner up. Same goes in the ED. If you have asked the ER attendings for help and you've asked all the patients that are appropriate and you still cannot find enough patients to participate, your students can partner up. Hopefully this is a rare instance because ideally each student should have their own patient for every BCS session. Interruptions. For interruptions of 10 or 15 minutes during the H&P, students will call you and should be given extra time. If there are interruptions that are longer than 15 minutes, this should be considered a patient dropout. Patient dropout includes patients requesting to terminate their sessions, patients who go to a test, long patient interruptions of 15 minutes or greater, or patients that have altered mental status. Depending on how much of the H&P is completed, students may still be able to complete an assessment and plan. If not enough information was obtained, please find the student another patient and the student will begin where they had previously left off. Poor student performance. If you feel comfortable to discuss these with the student, please do so. If the issues continue or you do not feel comfortable, please contact me. Same goes for issues with professionalism. If you feel comfortable, please bring these up with a student. But if they continue or are extreme, please contact me. Help with physical exams. If it's been a while since you've performed a complete head-to-toe exam, or you need help on a portion of the physical exam, please use the following resources. You can find physical exam videos using the link below. These are mastery videos that were filmed in our own sim department. You can also refer to the Schwartz textbook of physical diagnosis, history, and examination using the link below. Lastly, if you still need additional help, please contact the following people: John Bustos, Rahul Patwari, Christine Sai, or Sujita Kishore. When working in a hospital environment, there is always risk of exposures to infectious agents. Always check signs outside a patient's room for contact precautions. Please make sure that you and the student follow these. What happens during an exposure to bodily fluids or infectious agents? This would include a needle stick, a splash of fluid into an open cut, eyes, or the mouth, or exposure to an infection without an appropriate respirator. If any of these occur, stop the patient interview immediately. The site should be washed with soap and water, and the student should be sent to employee health during normal hours, and off hours should be sent to the ED. You can also contact me at any time. Subsequent BCS sessions. At the end of their first BCS session, students will have received their graded H&Ps as well as their scores on their grading rubric. During subsequent BCS sessions, faculty should review issues they have noted from prior write-ups and answer any questions students might have. Sometimes I keep a list of areas where I find the students are struggling. During subsequent sessions, I review this list with my groups at the beginning of each session and suggest solutions. It's also important to keep track of the chief complaint that each student has seen. If this is a new group of students for you, before assigning patients, ask them what they have previously seen. Try to give them a variety of chief complaints. You can find the rest of the course materials in Entrada. Please review these before your first BCS session. Lastly, I want to thank all of you for participating. Please contact me if you have any questions, and most importantly, please have fun.